Multiple clinical trials confirm direct correlation between LDL and coronary heart disease. I told it, you know that you are born with this slide. So nowadays, whenever a doctor is entering the MBBS course, they are given this slide. So they know that. So both magnitude and duration of LDL exposure impact. Now this is a new concept coming particularly from Qubix Ray's group from UK in the Oxford area, that not only the static 1 point LDL level, but the duration of LDL level. Like smoke here. I smoke 10 cigarettes a day for 10 years and I smoke 5 cigarettes a day for 20 years is the same. So it is number of cigarette into number of days. That is your current health harm today. Similarly, how long you are carrying this LDL burden in your body from the age of 8 or from the age of 80, that makes a difference. If you have first detected LDL high at the age of 80, that is not so bad because you are not expecting much. But if at the 8 years of age, your LDL is 170, then it is a tough time to go ahead.